Hi, this is Beaumont here with a quick introduction to the Patient Care Systems module, which is part of the MSc in Healthcare Informatics. I'm going to talk quickly about who am I. I'm going to talk also about the course, give you an overview of it, and I'm going to talk specifically about the assignments required for the course. Right, so you can find out me just by typing in my email address into Google or typing in my name, Robin Beaumont. I've got an interesting varied history. I did a degree in music, I did nursing for about 15 years, ended up teaching nursing, then I did an MSc in computer science, I ended up working as a lecturer at Newcastle University, and I also did quite a lot of stats teaching, particularly in psychology, which I still do occasionally. So, an overview of the course. Well, the course consists of two 10-week plots of work, and the first 10 weeks is concerned with introduction to systems modelling, and the second 10 weeks is concerned with development and evaluation of systems. So the first 10 weeks we're looking first of all at different types of health information system, then we're looking at a fairly old method of specifying databases, mainly entity relationship diagrams, but we'll swiftly move on to the core of the first part of the module, which is UML, Unified Modelling Language, and we'll be looking in detail at Unified Modelling Language because that is the focus of the assignment. With that, we'll also be downloading a special bit of software called Magicdraw, which is a case tool to construct the UML diagrams. Finally, because it's an MSc level module, we'll finish off by looking at the philosophical approaches to systems development. We'll see that a particular philosophical approach you take affects drastically which methods you use and how you go about defining the system. So that is the technical side of it, the first 10 weeks, and then the more human side of things come into the evaluation and development of systems in the second 10-week program, where I'll be critically evaluating information systems, seeing how that's done in terms of methodology, and we'll also be looking at how the social issues affect the implementation of healthcare decision support systems, affects both professions and patients. Right, as I say, it's 100 hours for each part, so that's 200 hours in total, and that's why it's divided over a 20-week period. Along with that, we're looking specifically at knowledge and also skills. The skills, as I mentioned, is to do with using Magicdraw, and also the skills in terms of systems evaluation is interviewing and developing questionnaires concerned with systems evaluation. Right, so I just want to concentrate on the first 10-week period now, and the first 10 weeks I've structured it into 10 weeks of work, and each of the links, when you go to the VML, you'll find links to a PDF file. Along with the PDF file, there's also a forum that we set up specifically for you for those topic areas. Also, each PDF has a set of multiple choice questions, and there's a multiple choice assignment at the end as well. So you can see that for each week I expect you to work through a PDF, and also we've got a skills column at the end specifying which UML tutorials you should work through as well with the Magicdraw software. So it's vitally important you download the Magicdraw software at the beginning of the course. We have a special educational license key for Magicdraw, which takes away the limitations that you normally have when you use just Magicdraw in evaluation copy. 10-week plan. We've got the knowledge basically in the PDFs with exercises and MCQs. We've got forums, how we discuss problems with one another and myself, and we've got some practical skills that you've got to learn as well. And you'll notice it's assignment focused, so right from week 1 I give you the assignment details. I don't actually give you the assignment scenario till about week 6 or 7, week 7 according to the schedule, but I give you practice scenarios you can work on before that. As you'll notice in week 2 you'll see scenarios document. You should perhaps look at those and work with one another to help develop UML diagrams using those scenarios. And you've got an online MCQ exam. The MCQ exam is not blind in the sense that you've shown all the MCQs during the 9 weeks beforehand. So if you work through all the PDF documents, you'll know all the MCQs you're likely to see in the exam. Obviously it's only a subset of the MCQs in the exam, and each person gets a different random sample from them. So we've placed over 150, I think, multiple choice questions in the system, and then each person gets 30 from that, a random sample for them to work through online. Right, the second 10 weeks we start off by looking at the concept of computer anxiety, and that has been developed over the years, different kind of measure to what was initially envisaged as computer anxiety. Then we look at user involvement and development and see how important user involvement is in development. There's a particular theory we look at concerned with this and see how that's developed also over the years, looking at the research literature. And we look at user support and the information centre. When I say the information centre here, I'm talking about the generic term information centre, not the information centre as it's defined by the NHS in England. And we look at user experience and evaluation. We review a large number of research articles, quite a lot in the 1990s by Edin, which may seem dated now, but usually students find them very useful. And we also develop some practical skills, as I say, in carrying out user interviews and developing the actual questionnaire yourself. And we finish by looking at clinical decision support systems. And we finally finish with looking at artificial intelligence. So, if you look at a typical clinical GP system, we can see that it has various functions. It deals with the consultation, it deals with audit, it deals with communications, secretarial roles, it deals with registration, it deals with appointments, and it deals with certain business aspects. And often the GP clinical system is divided into what's known as the front end and back end aspects. Those aspects of the system which are carried on before or after the consultation or by non-clinicians, and those aspects that are carried out during the consultation. And during the consultation mode you can see that there's history giving, there's prescribing, there's decision support in a rather basic manner in terms of perhaps looking up things in textbooks or giving electronic reminders or referencing protocols, but nothing really technically difficult in terms of decision support. And then there's the patient record to tell the clinician where they are in the stage of a particular illness or what's happening in terms of treatment plans for that particular illness. There might be a staged approach for some chronic conditions so they can see how far they're down that line. Guidelines, well, physicians tend not to like guidelines as much as administrators. Administrators always see guidelines as a way of reducing costs. Clinicians see them as a way of reducing possible textbook style medicine and not taking into account the wishes of the patient. And there's a good cartoon. The assignments, right, for each 10-week unit, I've got, as I say, the MCQs, the forum postings. You have to post at least 10 messages to the forums. Most people post at least 20, 30, helping one another out with problems with the exercises. And for the systems modelling part, the first part, you have to produce UML diagrams along with narratives, and that gives you 50% of the total marks. In systems development, the second part, we carry out a quantitative evaluation plan, and along with that you should put in a draft questionnaire. And obviously you'll see from the details of your assignment you should put in details of your interviews and how they helped inform the development of your questionnaire along with the academic research literature you looked at. Do you need to buy anything? Actually you don't. All the software is provided. You can download Magicdraw from the site, but remember, do use the key that the Royal College of Surgeons provides to make sure you end up with a full functioning version of the personal edition. And suggested books, well, if you look on the discussion forum and past comments from students and the PDF documents, it gives a list of a large number of books at the end of each week. You don't really need most of these. In fact, I'd say you don't need any of them. My notes are very extensive. So, we've had a quick overview there of both parts of the clinical systems course. We looked at the UML, XML, ERD techie side, and we also looked at the user focus of the human interaction side and evaluation of systems. Remember, it is 200 hours of work in total. You don't think when week 8 comes along you can cram in the 8 weeks you've missed so far. It's impossible. You need to start really working hard from week 1. And as I say, there's multiple assessments. It's not just carrying out a quick essay at the end. It's MCQs, the UML diagrams for the first part, development of interviews and questionnaires for the second part, and multiple choice questions. So let's have some things to think about. You need to think personally, how much of this knowledge have you got from past experience? If you've got a large amount of knowledge, then you can perhaps have a rest for 1 or 2 weeks and just skim over the material. Otherwise, you need to really work hard right from the word go. And you really need to be assignment focused right from week 1 to pass this unit. And because it's a distance learning course, I've tried to think of various ways that we can help one another. Well, the forums, they work very well if everyone contributes. Try not to be a lurker, try to contribute. Face-to-face meetings, quite a few people often live in clusters, even though it's based all around the world, this course. I often find that 1 or 2 people are in Scotland, or 1 or 2 people are in America, close by, or New Zealand, and they actually get together, often on Skype, helping one another. Similarly, telephone calls can help one another as well. The last thing, I just mentioned that actually I like mind maps, and in 1 or 2 places you'll see there are mind maps concerned with the material in the course. Actually design your own mind maps as well, and that helps. Don't worry too much about the software, there's lots of mind mapping software around, just do it on a scrap of paper. And it's a good way of trying to remember things as well if you have to keep drawing the mind maps. You may wonder why I've chosen these colours. Well, 1 week we discuss things about screen usability, and screen usability is obviously one aspect of it is colour and font size and font type, and there was an article I came across by Alison Hill which compares different font colours and font sizes, and she came up with this as being a good combination. Very interesting to know what you all think. Bye.